Have you ever wondered how challenging it might be to navigate the world with autism? Imagine a universe where the simple act of making eye contact feels like a mountainous task. Socializing, for many of us a source of joy and connection, becomes a difficult path of unspoken rules and overwhelming stimuli. The world, as we know it, is already difficult and challenging. Everyday tasks, such as brushing teeth or tying shoelaces, can morph into an overly difficult challenge. The comfort of routine becomes a lighthouse in the midst of a storm, an assurance of certainty in an unpredictable world. The journey of each individual with autism is unique, filled with their own triumphs and trials. But the common thread weaving through their stories is the resilience, persistence, and the courage to brave the world each day. Let's delve into one of the ways that may help. It's called applied behavior analysis, or ABA therapy. ABA therapy, what is it and how does it work? ABA stands for Applied Behavior Analysis. It's a type of therapy grounded in the scientific principles of learning and behavior. By understanding how behaviors work, and how environment influences behaviors, and how learning takes place, ABA therapy aids in improving socially significant behaviors. Now, you might be wondering, what are socially significant behaviors? These are behaviors that enhance our interactions with others and our environment. They can include things like communication skills, social skills, reading, academics, and even motor skills. So, how does ABA therapy work? It's about breaking down complex tasks into smaller, manageable steps. The process begins with a detailed assessment of each individual's skills and preferences. This forms the basis of a personalized treatment plan. The therapy then uses positive reinforcement to motivate the individual. When a desired behavior is demonstrated, it is rewarded, thus encouraging the individual to repeat it in the future. Over time, this helps to increase useful behaviors and reduce those that may be harmful or affect learning. But ABA therapy isn't just about cultivating good behaviors. It also teaches new skills, maintains positive behaviors, and even helps to generalize or transfer behavior from one situation to another. For instance, a child learning to communicate more effectively at home might also start to apply these skills at school or in the community. And let's not forget, ABA involves continuous data collection and analysis. This can be tracked, and the approach can be tweaked as necessary. The goal is always to maximize positive outcomes and foster independence. Sounds promising, doesn't it? But like any other therapy, ABA has its pros and cons. So, what makes ABA therapy a popular choice among many? One of the main perks of ABA therapy is its ability to enhance communication skills. It's not uncommon for children with autism to struggle expressing their thoughts, feelings, or needs. ABA therapy focuses on teaching these children how to use words, gestures, or even assistive technology to communicate effectively. Many parents have shared stories of how their child spoke their first words or started to engage in conversations after consistent therapy. ABA also works wonders in boosting focus and attention. For a child with autism, the world can sometimes feel overwhelming, making it difficult to concentrate. ABA provides a structured environment where these children can learn to focus on tasks, whether it's finishing a puzzle or following a set of instructions. Moreover, ABA therapy is known to reduce self-harm behaviors. Children on the autism spectrum sometimes resort to self-harm as a way to cope with distress or to communicate their discomfort. ABA therapy helps these children find healthier alternatives to communicate and cope with their feelings. There are countless stories of children who, thanks to ABA, have replaced self-harm behaviors with more constructive habits. And let's not forget about the improved social skills. ABA therapy often includes guidance on how to interact with peers, understand social cues, and participate in group activities. This can lead to more meaningful relationships and a better quality of life. These are just a few of the many benefits of ABA therapy. Of course, every child is unique, and what works wonders for one might not work the same for another. But countless success stories highlight the potential of ABA therapy to bring about significant improvements in a child's life. While these benefits are encouraging, it's also important to understand the potential downsides. But that's a discussion for our next scene. Stay tuned. ABA therapy isn't without its criticisms. Let's take a look. While applied behavior analysis therapy can be a powerful tool for some, it comes with its share of drawbacks. One of the most significant is the time commitment required. ABA therapy is a marathon, not a sprint. It often demands 20 to 40 hours a week of therapy, which can be a tremendous strain on both the child and the family. Even when the therapy is carried out in a caring, supportive environment, it can increase stress levels. It's essentially a process of learning and unlearning behaviors, which can be mentally and emotionally taxing for a child. There's also the financial commitment to consider. It's not just the time and stress. Families can find themselves in a tight spot, trying to give their child the best possible care while also juggling the financial implications. Isn't cheap, and while some insurance companies cover the costs, many don't. But perhaps the most poignant criticism comes from the very community it aims to help, the autistic community. Many individuals on the autism spectrum and their advocates argue that ABA therapy is not helping autistic individuals adapt to the world. A quote from an autistic blogger sums it up. ABA therapy is more about making us normal, rather than helping us navigate the world in our own way. So, where does this leave us? It's crucial to consider your child's individual needs and circumstances. It's clear that ABA therapy isn't a one-size-fits-all solution. So, with all this information, how do you decide if ABA therapy is right for your child? While ABA has its merits, it's essential to weigh them against these potential downsides. In the end, the best decisions are informed ones, made with love, understanding, and the ultimate well-being of the child in mind. First and foremost, consult with healthcare professionals. Pediatricians, psychologists, therapists, they all play a vital role in diagnosing and treating autism. Well, it all comes down to making informed decisions. You're not just picking a therapy out of a hat. You're choosing a path that could potentially transform your child's life. And that, my friends, requires thought, research, and most importantly, understanding. Every child is different, and their needs vary. They're the ones with the experience and knowledge to guide you. Understand your child's strengths and weaknesses, their likes and dislikes. Discuss your options with them. Understand the scope and potential of ABA therapy, but also remember to explore other alternatives. The internet is a vast resource, teeming with information. Next, consider your child's unique needs and behaviors. Some children may respond well to ABA therapy, while others may benefit more from other types of interventions. Look for reliable sources, read about both the successes and the failures. Be observant. This will help you tailor an approach that suits them best. Then, do your own research. There are numerous studies, articles, and testimonials available at your fingertips. Understand the pros and cons of ABA therapy and weigh them against your child's needs. But remember, information overload can be counterproductive. So, take it slow. You don't have to decide overnight. In fact, it's better if you take your time, absorb the information, and then make a decision. And finally, trust your instincts. As a parent, you know your child better than anyone else. Your intuition, coupled with the knowledge you've gained, will guide you to make the best decision. Remember, every child is unique, and what works for one may not work for another. And that's okay. The important thing is to find what works for your child, to help them grow and thrive in their own beautiful, unique way. We hope this discussion about ABA therapy has given you some food for thought. It's a complex subject, but one that's crucial to understanding and navigating the world of autism. Remember, this journey isn't one to be walked alone. Engaging with others who are navigating similar paths can provide invaluable insights and support. So, let's hear your thoughts. Share your experiences, your questions, your hopes in the comments section below. Your voice matters in this community. And if you found this video helpful, consider giving it a thumbs up. If you haven't already, do subscribe to our channel, the Autism Guidance Hub. It helps us reach more people who might benefit from these discussions. We're constantly working to bring you more resources and insights. Don't forget to hit the notification button for our next topic, autism and speech therapy, another piece of the puzzle. Together, we can navigate the complexities of autism. Thank you for joining us at Autism Guidance Hub.